Hello, welcome to Open Heart Surgery with Boots. I am your host, Boots Knighton, and today I am bringing you my new friend, Dawn Anderson from Adrian, Minnesota, which is the nutcracker capital of the world. And Dawn and I just recently met through Women Heart, which is a national organization I've spoken about prior to this episode and previous episodes. And Women Heart is a wonderful nonprofit organization that focuses on women with heart disease. So I encourage you to check them out. But thanks to them, they brought Dawn and I together, and we had the best time at the Mayo Clinic at the Science and Leadership Symposium. So, welcome, Dawn. Thank you for being here today.
Thank you for inviting me.
Now, tell us first, Nutcracker Capital. That is quite the distinction.
Well, Adrian itself isn't exactly the nutcracker capital, but a town 15 miles from here that I work in and grew up in, Laverne, is being designated or wants to as the nutcracker capital of the world. A lady who is quite elderly had collected nutcrackers, and she donated them all to the Historical Society, the society of which she was the president. So they accepted them, and they decided to use that as a gimmick to attract people to the town. And they are actually this spring building a 65, 70-foot tall nutcracker off the interstate to draw people in.
Wow. And then there's like Wall Drug, which is in the Dakotas, and now the Nutcracker Capital. That is so funny.
It's pretty interesting, that's for sure. And it's interesting. There's definitely opinions on both sides about whether or not they want the town to be called that, but right now that's what the powers that be are rolling with. So,
there are worse things to be worried about.
The worst things to be called.
In 2025, yes.
Yes. There could be worse distinctions for a hometown, that is for sure.
Yes. Well, and I am just here for your accent, and I just adore you. You have just the brightest spirit. So thanks for coming on and sharing your story. And your story is so unique. For myself, for those who are just now joining this podcast and have just found me, welcome. I'm so glad you're here. And if you want to know about my story, you can go back and listen to episodes 1 and 2. I have 3 different defects, one which has now been corrected, but Dawn might beat me. And I want you to know that Dawn is doing great. And that's why I wanted her to come on today, because you are such a beacon of hope and inspiration. So if you could just give us kind of like the 50,000 foot view of your diagnosis to start us off.
Sure. I was actually 41, and I had 4 children via C-section. I had a couple of abdominal surgeries, and the spring of 2011, I had to go back and look. I was thinking it was in like February or March, but it was actually sometime in May. I started to feel short of breath, and I didn't even realize it at the time, because sometimes when you're living it, it's so normal that you don't realize. So yeah, so I went to the doctor thinking that I had seasonal allergies. I'd never had them before, but I thought that must be what it was. And I went into the primary care clinic, and he put the stethoscope on my chest, and his eyes got big, and he said, and I said to him, well, I'm here because I need an inhaler I think I've got seasonal allergies. And he said, oh no, you need a cardiologist. And that was the impetus that started my heart journey. I never did
What did he hear? What was like the clue?
It was Well, I had a rare aortic aneurysm, and we did not know it at the time, but it had burst. I was walking around with it, and so he heard, and I'd heard sometimes when I was young, that sometimes they would hear funny things, a murmur here and a murmur there, but nothing ever stuck. So what he heard was the blood flow definitely not going the right way. And so that was May of 2011. And I underwent a lot of tests because what it turned out I had is so rare that it took a lot of tests to find it. So that's kind of the short version of how my story started.
Right. So, yeah. And now, what were those tests? Now we can go into the longer version because, I mean, it is quite the path.
Yes. Well, all the tests, and I actually when I went in to meet with the thoracic surgeon, he got out this big old thick book. It looked like a Encyclopedia Britannica from the 70s, and he flipped it open to this page and said, this is what you have. I said, have you ever seen this before? Oh, once, way back in Texas or something like that. So what they decided I had, and it was interesting because when I went in for my CAT scan, which of course, is very common, in anyone with heart disease, you know, has testing done every year and, to check things. So I went in and or for my sonogram, I guess. At some point the sonographer's eyes got really big, and she just kind of said, well, just a minute, I'm going to step out. And anyone that's ever had something like that, that's a red flag. And she came back in with someone. She said, well, I just wanted someone with more experience to help me. And I thought, oh, okay. And so what they determined I had was a sinus of Valsalva aneurysm. And I'd been born with it, and no one had known. And at some point, my primary doctor actually called me and apologized because I'd been in, for regular checkups for different things, and it had never shown up. And all of a sudden, apparently it burst, and the doctors wanted to know, did you have intense pain? Did you have? And I said, no. So we have no idea when this burst. Usually common is that if you have this, you have it your whole life and die and they never know. But otherwise, it's usually a medical emergency for any aneurysm to burst. And
Yeah.
yeah, so I was walking around with it, and that was in June, I believe, and I didn't have surgery to correct it until July. So it was, a couple months of tests and ruling this out and ruling that out. And so that was the first diagnosis. And they also determined that I had a bicuspid aortic valve. So they didn't know whether or not they would have to replace that. So I underwent an open heart surgery, and they repaired the aneurysm and decided that my valve, was still functioning well. They didn't want to replace it at the time.
Mm-hmm.
And so that was the first thing. And then later on, well, that started me on a journey where I would have like weakness and passing out. And I asked the doctors about it, and they kept saying, well, no, you're all right. And my heart rate was in like the 30s and 40s, and I am not an athlete. That's an athlete's heart rate. And they kept saying, no, you're fine as long as you're doing fine. And I said, well, I'm not doing fine. Sometimes I get dizzy and pass out. And so I think 4 years later, I passed out at work and went to a different doctor who said, oh, you need a pacemaker. And I felt so valued then because I had tried, I didn't know if it was a pacemaker that I needed, but I had tried to get them to acknowledge that a 30 and 40, heart rate is not what I should have. And so then I had the pacemaker implanted, and they determined that possibly where they put the patch for the aneurysm was right near the SA node, which instigates the heart rate. They almost wonder if something happened there.
Okay. But I'm
They're
just
not
thinking about
sure.
how you went 4 years advocating for yourself, and it took passing out at work and getting in front of a different medical provider. That drives me crazy hearing that.
Yep. Yes. And and I actually passed out several different times, and they just said they kind of poo-pooed it. And I just said, well, what happens if, if I do this while I'm driving or something, but
Exactly.
and all I did was, when I passed out at work, I think that was the second time, I made an appointment and went right over to, my main clinic, but just happened to see a different provider. And he's the one that said, no, let's get you set up. And I said, thank you.
Okay, so then how long did it take to get the pacemaker?
That didn't take very long at all. That's
Good.
I mean, I can't remember the timeline. But it's not a huge ordeal, but actually when they placed the pacemaker, they discovered another problem with my heart. And that is when they discovered that I had, and I have to make sure I say this right because sometimes I say it wrong, persistent left superior vena cava. And that means that when they put the pacemaker in, they generally put it on your left side, and where the wires go through in your veins, they got to my left superior vein, and it couldn't go anymore. And so they had to pull the wires back out. And apparently that is, it functions fine, but it is in backwards. So then they had to restart and put the pacemaker on the right-hand side and go through different veins. So that was another, surprise. And these are all congenital defects. So I've had these since birth. And we just, you just don't know. You don't know what's going on inside this human body.
Exactly. And at what age were you in 2011 when all this was discovered?
I was 41.
Yeah, and see,
So,
I was 42 when I began my
yep,
journey. Yep.
yep,
Yeah, and that's just something I really want to drive home today. Is people it's interesting. I'll get people who will like almost make a confession to me that like my community here in the Tetons, like, I don't listen to your podcast. And I'm like, that's fine. You don't have to. And they're like, I'm not a heart patient. And I'm like, no pressure. I mean, and it's so sweet that people like feel like they need to confess to me as if I am able to even notice or tell when people are, specific IP addresses or whatever. But I do gently push back a little and I say, I thought I was fine until I was
yes,
42. And all
yes.
these people are like binging on like murder and all these like Dr. Death and all these other podcasts. And I'm like, so don't you want to be educated on your heart more than murder? But yeah, anyway.
And that's really interesting, is that and it's interesting that we're discussing this on January 29th, because of course we're right on the cusp of February, which is Heart Month. And
Yep.
and one thing that during Heart Month, and as women heart champions, we've learned that, education, you just don't know when or if it will be your turn or your
Yep.
time. And
Yep.
so that's something very important that, you know, men and women have to remember, is is that you just never know when you might all of a sudden be walking the path of heart disease.
Right. Exactly.
And
And it will hit you like a
like
semi
a ton
truck.
of
At
bricks.
least it did
Yep.
for me. So
Yes, it will.
let's touch on that a little bit if you're willing. The short time I've known you, you're just so full of grace, and you're the classic um Midwestern personality, which I love. You embody the movie Fargo as far as Frances McDormand, and I love that. But eh, I have to know, like, did you get upset? Like, how did you cope with this? Like, what was it like for you to learn about all of this?
I th- I think, to be honest with you, that it was that I didn't at all grasp the concept of the seriousness of it. I At the time I worked in public health, and so um, I would Google all the time. Every time I had a test, I'd go on my portal and I'd say, "Well, I wonder what that could mean," and maybe they think it is this. I didn't. I didn't. I think until I actually had to face the open heart surgery, I did not grasp the seriousness of it because I'd had it for so long. And what really hit it home with me is that because um of course the aneurysm is very rare, but the bicuspid valves are not that uncommon. So each of my kids had to be tested to make sure that they didn't have it. That was an eye-opening experience because, as a parent, it's okay if I go through struggles because I know I can handle it. But to find out that, well, this might be affecting my children, that I didn't like. But
I
it
bet.
turned out they all turned out all right. But I did in the last few months read that um, children of people that have had aneurysms, even though like my kids have all been, had the testing and found that they don't have the valve, when they turn 30, they should have another one to determine that something hasn't developed, like an aneurysm hasn't developed. So now trying to tell my adult children who, may or may not want to believe me that, just do a baseline test because you don't know you have a um, higher rate of possibility of developing an aneurysm.
Yeah. Yeah, this is where sometimes ignorance is bliss, but at the same
Yes,
time, knowledge is power, but ignorance is
knowledge is
bliss.
power.
It's
Mm-hmm.
like going back and
Yep.
forth.
Yes. Yeah. And then you just want to learn all you can about what is going on with your body and what you can do to change and to fix and to teach others so that that if they're walking the same road, that that there's hope out there and that there's support. And that's one thing with the Women Heart. um, I'm so glad, like you, that I found that organization because it, the support and the knowledge is just unbelievable.
Yeah. Yeah, it really is. And they bring in the best and the brightest from like the Mayo Clinic and incredible learning. And I had Dr. Laura Suarez Pardo on in December talking about cardiac psychiatry, which was amazing. And I hope to have a few of
Hmm.
the other members that we got to meet here in 2025. So, how, with your open heart surgery, how was your recovery?
My recovery actually went really well. I got very lucky. And it's kind of interesting because we had kind of heard or known that the place that I worked at was going to be going through some changes and that several of us may be laid off. And while I was in the hospital recuperating, my supervisor came and I thought that she was there to visit, which I think she kind of was. but she also was there to let me know that when I get home, my the yellow slip or white slip or whatever, would be in the mail. So,
Oh, bummer.
you know, yeah,
Thanks.
yeah, and so here I am, and so I went back to work earlier, but I mean I felt okay, and I also worked in healthcare with a whole, I told the doctor that I'm so very safe. I'm in a bigger town. I'm with all nurses, and I felt good. So I went back to work sooner than what they recommended. I think after just 5 weeks instead of, the 8 to 12 that they want, mainly because I knew I was going to be losing my job in just a few months and I needed to, I had a lot of bills to pay. So that really, there was, more stress because of that and having that go on too.
Hmm. And you don't think that negatively impacted your recovery, though, in the long term?
I don't. I think
Okay.
that something
That's
very
amazing.
positive came out of it actually, because one time when I was in, I think I know you've done podcasts about cardiac depression, and I think I was in I was in depression and I didn't realize it. And one time when I went in just for one of my, and not to the cardiologist, but to my primary care doctor, um, she just sat me down and said, "Dawn, think about all of what you've been going through." And she said, I think it would be beneficial for you to start on an antidepressant because you're losing your job. You've just undergone major surgery, and that was something that I needed that I didn't even realize. That I was depressed and I did not know it, and that medication has made a huge difference in my life. It made me. I've told so many people that I'd probably quit taking my heart medications before I'd stop taking my antidepressant because I didn't know, and I wouldn't actually, but I didn't know how much better my life was going to be. And so it technically, it actually worked out to my benefit because the doctor kind of recognized, you're under a lot of stress, Dawn, and you don't realize it.
Yeah. Yeah. That's that's a couple of times I've kinda heard you say, like, you didn't realize how serious it was at first, and then you didn't realize you were depressed, and I I bring that up because I experienced the same thing, and when you're in this, like, extreme pressure cooker of
Mhm.
going from thinking your heart is fine to not, um, it is a 5 alarm fire, and you're
Mhm.
just trying to figure out what needs to be done, and what needs to happen next, and who to go see for this and that, and get all your ducks in a row. You don't have time to, like, really be aware.
You don't have time to focus on what's on the peripheral. You are just focused at what is right in front of you,
Staying alive.
staying alive.
Mhm.
And that makes that, yeah, and that can affect, well, obviously my mental health, but my physical health. I mean, it just the waves just, you know, of how it impacts your life and your livelihood. Yeah, it's something else how that can happen.
Yeah. So I just wanna normalize that for people because you're not the
Yes.
first person I've had the pleasure and honor of interviewing who has reported the same thing. It is just so much to manage, and I, just aired a, episode with Kina, another, heart
Mhm.
champion of ours,
Mhm.
and she kind of said the same thing. She didn't cry until, like, shoot, what did she say? 4 years later after her
Mhm.
heart surgery, and once the day it hit her, she just cried for, like, a really long time. Like, all of a sudden, her body was just like, "Okay, it's time. I'm gonna cry now. I'm gonna really feel what I need to feel about this whole thing." And what was ironic was the day I interviewed her was the day of my 4-year anniversary, or it was
Oh.
right around there. And it was hitting me in a whole new way, my own heart
Mhm.
journey 4 years later. And I've been working with the same therapist since 2014. And I have huge awareness skills, and I'm still figuring this out and just still kind of unpacking the journey. So I just want to normalize all of that.
I think it's just such an ongoing process, and it's interesting when you say how it hits you. Um, I I don't know if you've done any podcasts on heart survivor guilt, or if that is something that but I had a friend, someone that I know who literally is the same exact age as me. We share a birthday. And her husband had a heart emergency, ended up in the hospital, and passed away. And I suffered what I call cardiac depression. I had survivor guilt that why him? Why not me? So that was another wave that hit me, and completely out of the blue. I was not expecting that, because and he's a good man, a good husband, why him, and why not me? And so that is something that I definitely struggled with, and that was in 2017 when he passed away. So 6 years in, um, so yeah, survivor guilt.
Yeah. I haven't recorded an episode on that, and I need to, because one of my dearest friends from childhood died of a massive heart attack in her sleep at age 48, the
Mhm.
day before Thanksgiving this last year. And she had 2 kids, a husband, loving community, and I'm just like, "Why did I get to live?" So
Yes.
yes, it is a thing. It is absolutely a thing. And I think that's just when we're facing our own humanity, and that's
Yes.
when the questions are bigger than our pay grade.
Yes, you're right. And we will never know, we will, never know why. But it's interesting how something like that you don't even think of can just hit you, like, so strongly out of the blue.
Oh, yeah. Yeah, it's a thing. And, any emotion that comes up for us is valid, and it's
Yes.
just our psyche just processing. And I think the greatest gift we can give ourselves is grace, mind, body, spirit.
Yes. And not just us, but others too. Yes.
Yes,
Grace
I'm still
is
working on that, Dawn. I'm still working on that.
yes, grace
Any
and patience.
any parting advice for those coming after you and I, like a lot of people listen to this podcast that are just now starting out on their journeys. And so, for those just starting out, what do you want to tell them?
Listen to your body and don't be afraid to ask. Um, don't be afraid to question, and don't be afraid to advocate for yourself. Um, that it's very important, because you know you're normal more than anyone else. So if something doesn't feel right to you, say that. Stand up and yell, I need to be listened to. And I know you've talked about that multiple times, Boots. But and also don't be afraid to reach out. Get education, get support. There's so many people out there that are living with heart disease, and the support, you might not realize it, but it is out there. And there's people that are willing to, help you walk the journey. The women heart champions, volunteers. Educate yourself, and ask questions.
Yeah. And it's amazing to me, Don, how many people are so anxious to help, that just really want to make it better for those
Hmm.
coming after them. And I think of you and all the other guests that have been willing to be vulnerable and share your stories on this podcast. And that is a way of helping those. So thank you for your willingness today.
Well, that is no problem. I am no different than anyone else. So you just don't know. And And we need the heart to love, to live. So take care of your heart and don't be afraid to ask someone and share it with someone.
I can't think of wiser words to end with. So thank you, Dawn Anderson, coming at us from near the Nutcracker
Cracker
capital.
capital, yes. You'll have to look it up sometime. Laverne, Minnesota, the Nutcracker capital of the world.
And thank you again, listeners, for being here today, for supporting this podcast. If you would consider, there are two different ways that you can financially show your support. You can join our Patreon community, which I'll put in the show notes. And also, you can buy me a coffee. That is a website where you literally can go to buy me a coffee and throw a little bit of support my way. It really does make a difference. This is not free. I'm doing this from the goodness of my heart, but it is a lot to carry financially. So your support matters. And don't forget to subscribe. I don't want you to miss another episode of Open Heart Surgery with Boots. Please be sure to come back next week for another episode. And until then, remember that I love you, you matter, and your heart is your best friend.
Amen.